Representative Morrison?
Yes.
My name's Rhonda Mackey, and I was just wondering if I could have 3 minutes of your time today to talk about House Bill 1444. It's relating to healthcare directives and the end of life treatment.
Have a seat.
Thank you. House Bill 1444 is the same bill as Senate Bill 303, which was passed unanimously in the Senate, the last legislation. House Bill 144, though, was tabled in the House committee. And so my goal is to go down and get support for this House bill so that we can get it voted on and passed during the next session. House Bill 1444 requires that all patients be treated equally. It states one cannot withhold or withdraw pain management medication, medical procedures considered necessary to provide comfort care. Consumers should be affordable the opportunity to make the decisions about end-of-life care.
But I thought there was already a bill in place that addresses this.
There is a bill, and it's been in place for about 14 years, but there's a lot of gray area in this bill. It's going to make it better for the families and the patients. Patients can be subject to truly unnecessary and perhaps painful treatments right now, and so this new law is going to help take away that gray area. But there is also my biggest concern is right now that doctors can put into the patient's chart a DNR secretly. So this new law is going to require that the doctor has to notify the family before doing so. If the family disagrees with this, they can take this to a medical ethical committee, and the committee will meet with the family and they will talk about it. Now, if that committee agrees with the doctor, then the patient and their family has, instead of 10 days, it goes to 21 days to find someone else willing to provide this care for these patients. Have you ever had a family member that you had to make a difficult decision for? Well, this is a very difficult time for the families, and they're very unfamiliar with how the healthcare works. So this bill is also going to provide a liaison to help this family through the process. This bill will also give the families free copies of their medical records. The patient should be everyone's main concern. There's a doctor, Dr. Freeman, that states legislating the end of life is tricky, but for us, how we prepare for the end of life is much more important because we're all going to die. So, Representative Morrison, can we count on your support for this bill, House Bill 1444?
Most certainly.
Thank you so much for your time and your support.
You're welcome.